the first question I wanted to dive into is, how are community health centers different from typical providers? Tell us a little more about that.
Well, I think the one-liner for this is community health centers forms the backbone of the US rural health system. So community health centers are available in places where people don't have that privilege to access medical facilities, be it in terms of the monetary reasons, be it in terms of the type of services they want to procure. One good thing I read about community health centers is that they don't care about what type of insurances you have as a patient. Regardless of whether you have insurances at all, they're going to provide you with the best possible care. And that's primarily the biggest difference between a community health center and a large financial healthcare institution.
Yeah. And we found that almost any type of provider, regardless of what direction they go in or what they specialize in, they tend to have pretty similar problems and similar issues that they're dealing with because there's so much manual work needed within healthcare operations. So one question is AI. Why AI? Like, why does a community health center need AI? Is it essential? And if so, why is it essential?
Yeah, I mean, in general, providers do need AI. This has been the topic over the last 2 years now. Like, where can AI be used to optimize efficiencies? Let's talk about community health centers for a second. What are some of the biggest challenges they are facing? The first big challenge they are facing is limited administrative staff or staffing shortages, And you talk about resource shortages, staffing shortages. When you talk about staffing shortage, it comes in form of administrative task or clinical task, right? Like you don't have X number of members you need to be on the patient access side, or you need to have 7 or 8 members in the medical billing side. You don't have that. Can AI be a replicated option of it? I think perhaps the answer to that question is yes. So that's one of the primary areas where AI can address the resource shortages. The second point that immediately comes to my mind, Gabe, is limited access to care. Like community health centers is designed to serve the patients in rural areas. When it comes to specialist cares and stuff like that, you won't have that access in rural areas. So there are a lot of AI-based telehealth platforms which can provide remote access, remote consultations to patients. So you can even ensure timely access to care being in a remote location with the help of AI tools. So these are the two areas where I think community health centers can definitely leverage AI to be at par when it comes to the quality of care they're providing.